Hey there, it's Kelly from ZiniMe. Before we get started on today's episode, I want to invite you to one of our greatest trainings ever. It's how to build and grow a profitable solo or group practice sustainably. All you got to do is check it out at zinime.com/podcast. All right, on to our episode. Welcome back to the podcast. Today's a special one. You've got me, Kelly, and
Miranda. That was a weird voice. I understand.
Today we're going to be talking about what's going on in the mental health field. We're doing these on occasion in between our success stories where we're sharing real boots on the ground stories of what clinicians are going through in private practice. But we also want to talk about what we are seeing kind of at a global level in the mental health field. And before we started, I was telling Miranda, what is working? What is good? What are the fears? And maybe can we mitigate some of them? Not to bypass real things that are happening in the world, but also to just kind of take a clear, more data-based approach, I think, to addressing the common fears that we're seeing in clinicians today.
I think one of the pieces that I have heard a lot are people saying, I don't think therapy, people aren't really looking for therapy anymore. Maybe people are looking for coaching more than they're looking for therapists. Maybe people just aren't searching for therapy online or whatever those pieces are. And it's interesting because I do think it can feel that way. It can feel that way for therapists who, maybe had the experience of starting their practice a long time ago or talking to someone who started their practice a long time ago. And that person says, well, you just put up a Psychology Today directory and that'll fill up your practice and you'll be fine. And then somebody has that experience and says, well, I haven't gotten a call from Psychology Today ever, or I haven't gotten a call in 3 months, or I'm only getting one call per month. That's not enough to fill up a practice. So whenever that comes up, I really like to go and drive into the data. And here's the good news. I haven't found a situation as of yet for any person where that's the issue, that people just are not looking for therapy. Even today, and we're recording this on July 10th of 2025, there are on a monthly basis, according to Google, 27,100 searches per month of people looking to find a therapist. And if I look at this at all-time data from 2003 is how far back this goes, this is actually one of the highest times in history of the amount of people who are looking to find a therapist. Right. So back in 2003, it was, a little high of around 15,000. In the 2015s, it dropped down to, or actually 2013, maybe 8,500 searches per month. And then here we are in 2025, and we're up at the highest levels, while we know that there's a lot of things that are happening and shifting. And so I think that piece of understanding that people are really truly looking for therapists, that is really true. I think the other data point is that there are more people, from looking at different research studies that have come out, there are more people who are leaving the profession than entering it. So the demand that we have for therapy is actually more than what we can provide, person to person in theory, logistically. And so I think there's this really, and again, that could be a good and a bad thing, right? But I think there's a good place to dive into. Our labor is deeply wanted and it's deeply needed. And it isn't something that can be replicated, in my opinion, if we're doing it well. It's irreplaceable.
Yeah, I was thinking back to, I think the other things that influence this feeling of no one's looking is that they are looking, like you said, from the data, but there's different options than there were.
Yeah.
There's more people vying for the attention of these
Yes.
people looking for therapy. And it's why now more than ever, we need to differentiate and be really clear about what good therapy is. I was talking with a clinician this week who does intensives. And they had this couple come in and they found out that one of the spouses was in therapy, but with a BetterHelp therapist very sporadically.
Mm.
And after this couple experienced the intensive, they're like, well, this is what therapy is. And so I think some people, are searching. They're just landing in some of the places that aren't a really good fit for them. And that's why we need to be more visible, more present, more differentiated.
And I do think that is a good thing. Like, there are more people today who are also not just looking for any therapist, but they're figuring out that they can look for an online therapist, find someone that can help them with PTSD, find
Yeah.
someone that can help them with trauma or anxiety or insomnia or infidelity or, substance abuse. Like, they get to not just walk in the door and assume that this person has not just, I mean, we're all trained to have this broad level of knowledge,
Right.
but that doesn't mean we have expertise. It doesn't mean we have specialty and we really know what to do with everybody who comes in the door. And not all of the theoretical orientations that we've been trained in are appropriate for all issues. Like, they don't always work. And I think also we were not trained in how to track if what we're doing is working, or given the confidence to be able to refer out if it's not.
Right.
I remember being really shamed when I said, I can't see this person. Like, I don't have the expertise. And they said, well, there's no one else. So you're going to have to do what you need to do. And then
Mm.
even when I had a supervisor who was like, no, like, this person has OCD, like, you do not have the chops. Like, this is really significant. You need to refer this person out. It felt so frustrating because I couldn't find any OCD specialists
Mhm.
at that point. This person's budget didn't allow that. And so it
Mhm.
felt like I was just rejecting this person out into
Mhm.
the world and saying, you really need an OCD therapist. Here's a couple of names, but none of them had websites. None of them I could say, well, here's a training that they did. Here's a blog that
Yeah.
they wrote so that this person could feel the sense of connection and make that transition. And there's so much more of that, like, client-centered opportunity out there than ever before. And I
Mhm.
think that is like such a magical thing.
I do think on the flip side of what I'm saying of there's more options, I kind of off of what you're saying, feel that people are getting more savvy. Like EMDR used to never be a search term. And now for a lot of areas, even some small like suburban areas, EMDR, I know you're going to type in the data.
I am.
Right? So people are getting more specific in what they're looking for. What does the data say, Miranda?
So the amount of people who are searching for therapists near me it was, let me just make sure, 27,100. And the amount of people who are looking for EMDR therapists near me is 27,100. So it is equal. Now, it's not the same. The competition is different. The cost per click
Yeah.
is different.
Yeah.
But that is how close it is. So even if I type in EMDR therapist in Los Angeles, there's 720 searches just for EMDR therapist Los Angeles.
Right.
If I was to do like San Diego, 120 searches, San Francisco, 260 searches. Like, there's a lot of people, EMDR therapists in San Jose, 110 searches. And again, this is not just specific to like San Antonio is 390 searches. That's in Texas.
Yeah.
So there are people who are really getting clarity. They're hearing more stories of how therapy has worked for people and what the experience has been like. And so they're more informed. I mean, we've always been out there to provide people with informed consent. But most of us weren't trained how to really provide people informed consent. Like, that idea of how therapy works with you and like what the process is. Like, my opinion has always been like what people would think therapy was based on what they saw on TV. And what people saw on TV is people laying down on couches, people having sex with their therapists. Like, they're seeing like a lot of bad things. And then, but over the last like 10 years, I was rewatching Grey's Anatomy. They have some great, good like replications or whatever of therapy throughout Grey's Anatomy in several different scenarios and different theoretical orientations or what have you. Like, there is more good experiences of therapists who are not being inappropriate now than ever before. which I think
Yeah.
is just amazing.
And I think if you're open to it, I think we should delve in a little bit to like, because I can understand that someone listening to us might be like, well, you guys always talk about how I don't need another certification. Because we're not saying that means you should be EMDR certified, because that's what people are searching for. Because I think it's really important. And you're talking about expertise, and then we say,
Yeah.
well, you don't need a certification.
Yeah.
And so I'd like to kind of open that up a little bit more and
Yeah.
delve into that murkiness so that
Yeah.
people are really clear about what we're talking about.
Or I would say even like the nuance of it.
Nuance. Thank you.
Yeah. Versus, I
Sure.
don't think it's murky. I think it's nuanced.
Nuanced. I agree. So people are becoming more educated, more savvy, looking into things, and it's still being clear about who we are and how we show up. And I think to start that broad base of being a therapist, it's enough, right? It is enough. Getting the specialization is a intuitive, deep knowing of like what you feel drawn to, a tool that you want to use. It's not driven by fear or scarcity. And at the end of the day, certified or not, as clinicians, we still need to be able to express how this work is unique and how transformative it can be.
I think also, like, let's talk about the nuance of training versus certification,
No.
because I think there's the nuance of, should you be getting training? That is part of our licensure. We're supposed to get continuing education units. Like,
Yes.
after the first couple of years, you're supposed to be going and getting trained every year. Are you being intentional with those training hours based on the kind of clients you're seeing? Are you tracking your outcomes so you kind of know where you're in flow and where you have sticky points? Are you being niched enough? It doesn't mean you have to have some ultra specific niche, y'all, but are you being focused enough in your work that you, whatever training you're getting, is going to have an impact
Impact, yeah.
most of the people that you're coming in? Because if, for example, you're seeing one person who has severe OCD, you're seeing one person that has severe, and we would call it sex addiction in like a significant way. They have the super painful medically acting out, whatever. We have this person. And then we're working with a polyamorous couple over here in a throuple. And then we're working with, again, fill in the blank over here of somebody has a panic disorder and that is also having physical and medical symptoms, and they're getting, their body
You're
is
just
going through
piling it
somatic,
on, Miranda.
right?
You're just piling it on.
Piling it on. But this is what I think a lot of therapists feel drawn to do, because it's this, you got to take work when you can get it. You're trained not to say no. You don't know where to refer someone out. If you think that BetterHelp and growth therapy and all of these other scenarios are really making referrals based on people's expertise, it's not happening a lot. So those are real scenarios that could happen. Maybe they're not all that insane, but like, it's a lot. So if you're going and trying to read up on and get trained in all of these areas concurrently, the odds that you're going to be really great with any of these clients is not very good. And at the same time, if you just said, I'm really going to work with people who are struggling with relationships, I really want to dive into couples and thruples. Like, this is what I want to do. I want to do relational pieces. That is going to have a different scenario. Okay, so now I went on this sidetrack. So back to the difference between training and certifications. So we go through this training process, and we go to the training and we start to implement. And then there's this pull sometimes, whether that actually feels like a good fit for you, like
Bless you.
sorry, what you just learned actually feels good and feels good with your clients, that if it's not flowing, or even if it is flowing, that you must go through the whole process of $15,000 to $30,000
Uh,
of certifications.
Can I just like full confession, right?
Yeah.
Doing brain spotting training. And there are those of you who are certified in brain spotting.
Yeah.
This is not to step on your toes. I know my heart. But honestly, I struggled. I was like, should I go through the certification? Why is this certified? Who created this? And there's a lot of like colonization of therapy here that we could even delve into.
Mhm.
But it's this interesting, like, it's bred into me to be like, oh, I've done level 1, I've done level 2, I should go do, you know,
Yeah,
and I'm
and then
like,
I do level 3, and then I should become a master's, like
why? And I had to really grapple with myself and be
yeah.
like, what am I why? What is driving this? And you said something earlier about being intentional, doing a training knowing this is going to improve the clinical outcomes with my clients, when a lot of times people are doing certifications to improve the way they feel about themselves, to try
Yeah.
to feed the insecurity or fear that they're carrying. And I think that that's a delineation, you know?
It is a nuance. It is a delineation, and to call this out too, the next time you're at a training, y'all, notice the people who are supporting that training.
Mm.
And ask whether those people are getting paid to be there.
Mhm.
These people that are also well trained, who are checking people in, who are supporting, who are speaking, who are taking a whole day out of their life or their certification, who have already paid to go through trainings beforehand. Ask if those people are being paid. There is an interesting little dynamic sometimes in these paths where it can also start to bring in this place of wanting to feel accepted, wanting
Mhm.
to feel liked, to be in the clique, to if I get to know this person who knows this person,
Right.
then it's like a magical thing that like the closest like like I get to say that I got EMDR therapy from Francine Shapiro. Like, oh wow, like does that matter? No, it probably means at the end of the day, it was a bigger room. There was more people. I got less time with the trainer with Francine than when I went to do my part 2, right? Like
Like in some of these trainings, we know people who assist in different kinds of trainings and different kinds of modality. And
yeah,
when they've brought up getting paid, they've been told you get visibility. Well, visibility does not pay the mortgage, you know? And so it's just an interesting industry, the whole thing about certification.
yeah,
Not saying that you
yeah,
may really need a certification for some reason. Cool. Then whatever we're saying right now won't bother you because you know what's
yeah,
right for you, right? It's not going to activate because you're clear about your own knowing. We're
yeah,
just talking about that nuance of like
yeah,
what's driving the motivation for the certification. And
yeah,
that idea of we need better for ourselves and our clients
yeah.
and getting ongoing training. Yeah, I love that nuance. Like training is always happening, certification.
Yeah. I mean, and it used to be that if you had a helper at the training who was doing it for free, that was for students and pre-licensed folks to like do the check-in. It wasn't someone who's already been through 100 hours of training is
Right.
coming back to do this process with you. And again, people can feel different ways about that, but I would personally rather pay a little bit more even if it was $20 more per person to know
Right.
that every person that's there that's a part of the training and bringing their expertise is getting paid to be there, even if it's a small stipend, even if it's not really worth the same amount. Like I want to feel really good about where I'm putting my training dollars, just like, all the other pieces of it. So
Same.
okay, so back to that nuance part. This is the other like good part that can sometimes be a little bit overwhelming. We have access to more training modalities
Mhm.
and more options for healing and helping than ever before. And I think it can be a little bit of a double-edged sword. Back to your point of people repackaging things, like that was actually what kept me out of brain spotting for a long time was the place of like, is this really any different from EMDR? Like, are we just
Mhm.
repackaging this with another name? And it was sort of like a yes and. I really appreciated the brain spotting training. I like the setup for brain spotting much more than EMDR.
Mhm.
And as I go through the other trainings, there's a lot of the same things that I learned in EMDR just have a different
Right.
name in brain spotting. And so it's a funny,
Mhm.
experience for me to like navigate through and uncomfortable conversation, right? Brain spotting is very clear that it's not specifically a psychotherapy intervention, that this can be used by coaches. This could be used by anybody.
Mhm.
And if you start to get into going to yoga classes and you're going into some other things and you understand what brain spotting is, some of the same techniques and modalities are used in a lot of things that are outside of the therapy world,
Right.
right? which is really interesting.
I know. So when we kind of come back to this, I hope this kind of clarifies for people of like, with more options, with a shift in the way people are looking for care, now we need to get into really what it is about us, what it is about you the listener, and your work and your way of showing up and the kind of transformation that you guide people through or facilitate. I'm not saying that you're the sole reason someone transforms. It is that attunement, it's the relationship, it's the effort of the client as well. But are we clear about what sets us apart? And we're recording this before we do this training. By the time this comes out, the training will have come out on AI and AI therapy. And one of the things we talk about in that training is like, we get fearful because we're not clear, right? So fear, shame, all of these are just like signals to us to pay attention of like, I don't feel solid within myself, you know? I have some sort of murkiness and that needs attention. That's all it's saying is like, so if we feel fearful about AI taking over therapy or, you know, better helps and tech companies like obliterating us, then we need to get clearer about ourselves so that we're differentiated. We're not even playing in the same waters, as we say, the blue ocean, you know, blue ocean book or whatever. And I do think that is happening. We are seeing, and this, I hope this is encouragement. And people talk on our success stories, you know, about what they're doing that works. And we're going to have a panel come up in 2025 of therapists and what is working for them. It is working for therapists who are clear, who are talking about the work they do and how transformative it is. And people are having viable practices. People are full and not burning out. We're not talking about full at $30 an hour and burnt out and exhausted. We're talking about being able to take a trip, being able to pay for maternity leave, being able to afford to, unfortunately, get sick, but, you know, these kinds of things and manage whatever life throws their way and still have a practice that they like waking up to.
I think that piece, that fear, right? And this can be an interesting experience. I think that fear is what leads a lot of people to give their labor to other companies until their private practice is going,
Yeah.
not realizing that they are, you know, in a sense, like competing against themselves. We talked about this like years ago when we started. I mean, we've been doing business school itself for 11, 12 years. We've been doing ZeddyMe for 15 years. Like we've been doing this for a long time.
We have a teenager on our hands.
Yeah. Yeah. I have an adult that,
Well, you have an adult in your own life, and
yes,
then together we have a teenager.
yes, that is a true statement. Yeah. It's a wild experience. And we used to talk about this idea of people saying, well, the reason I have to take insurance is because every person who calls me needs to use their insurance. And I would say, okay, well, how many insurance panels are they on? And they'd say, well, I'm on 11 panels. And you go, okay, cool. Well, if you're on 11 panels, every single person that calls you you're already paneled with them. So you can't find a private pay client because you are paneled with everyone that could be a private pay client. Until you start to say no to particular insurance contracts, every person that calls you is going to be quote unquote an insurance client, right? And it's this really interesting experience of people saying, well, everybody wants to use their insurance. And I think that's true. Like, why wouldn't somebody want to use the thing that they paid for, right? Well, I know you don't want to use the thing, but
No,
like,
but I just had an experience where I
mm,
went and I saw got a surgical consult, and he billed for up to 60 minutes for $100, and it got applied to my deductible. And I was like, and I still had to pay like 200, and he saw me less than 3 minutes. I looked at my phone. So I
oh,
called the doctor's office and they're like, well, we're applying it to your deductible. And I was just like, I'd rather pay cash for 3 minutes. So I was like,
yeah,
I thought I would like using my insurance, but I was like, I don't know. I have this insurance. I'd rather
yeah,
pay cash for some of this, you know?
yeah.
So
I think that is the part where people end up down the rabbit hole of I want to use my insurance, but then I'm down this place of I can't find the person. I'm on a waiting list. I finally get into the person. They're not fully present. They're falling asleep. They don't have the expertise that I need, like whatever is happening down this path, right? And this isn't all therapists. There are some amazing therapists out there that you are on insurance, you're doing great work, you're getting great outcomes. That's fantastic. But some of you are seeing way too many clients. You're seeing twice as many as you can. You're feeling burnt. You're you're barely able or not able to keep up with the paperwork. You're super at risk of clawbacks and all kinds of funky things happening. And at like a core place, it feels uncomfortable to know like, oh, I'm not showing up in the way that I would like to. Now, the scenario is therapists say, well, if we could all unionize and we could get together, we could all get together and we could negotiate with the insurance companies to make sure that we have a livable wage. But that's too much of a side note, but like it's an illegal thing for businesses to come together and negotiate that way. What we can do is as individual businesses, if we say no to the contract and they can't find enough people to service their patients, which are their actual customers. Your client is their customer. You are not the customer. If they can't do that, then they have an obligation to find service providers. And I think we as therapists continually stand in the gap, and we're the people that allowed in 2023 United Healthcare to have $23 billion in profit. And then we go, well, gosh, it's really frustrating when, I can't find anybody on my insurance panel, but you are their client, you are their customer. You call the patient's rights advocate and you say, hey, there's nobody available. You need to find this. I need this service. And patient's rights needs to go and find that person for you. And they need to pay and negotiate with that person. And now, if this is a therapist, for example, that therapist now has a lot of bargaining power to say, this is my fee, period. Right? Now, there are therapists who would absolutely be paneled for a little bit less than the fee. Like if they knew they didn't have to do any marketing and whatever the things, they could take this out of their budget, they would say, yeah, let me sign up for this panel. It's taken care of. You fill me up and we're good to go. But what we're finding right now is there's a lot of insurance companies across the country who are not filling people up, that they're actually now creating these dynamics where they're only going through other online tech companies as that connector, while those online tech companies are also developing AI therapists and AI chatbots. And you go, and those are not reimbursing well. So, but they can't do any of that. This is the power part, right back to the goodness. They can't do any of it without your labor. They need your labor. They can't do anything without it. Isn't that magical? Like, do you like feel it in your body, this idea that like you were maybe like called to this work and you are a healer and like what you do is so freaking important? And could you like come back to that like deep truth that had nothing to do with feeling burnt out, overwhelmed? Like that deep truth was not trying to call you into something that was going to suck you dry. That deep truth was like, I have medicine within me. I'm meant to be a healer. If I wasn't doing this work in this way, in this capitalistic society, right, I probably would have had somebody else who was a healer in my lineage or somebody else that was in the village, and I would have trained alongside them and they would have helped me through the process and I would just be healing. It's just what I
Mm.
would do.
I think we've covered a lot of ground.
We did.
So people are looking for therapists. People do need the kind of work that you do. And it's actually the demand is more than ever. So take heart and know that there's a place for you here at the table. And sometimes we have to take a chair back from like a company or someone else that's sitting there that maybe doesn't need to be at the table. Billionaires, And that's truly why we're still here 15 years later. I mean, we've seen so many changes and we are foreseeing some more. And I still believe like private practice is one of the best ways that we can show up with our healing skills. Yeah.
If this was helpful for you, we would love to hear from you. I don't know how much I can say, like, we love to hear from you, whether you want to review us on your podcast thing of choice or just send us an email at help@zennime.com. Let us know that taking an hour out to record this conversation was helpful for you. Send it to a friend, to a colleague. I want to hear from you.
All right. Till next time.
I hope you loved today's episode. If you're a therapist who's tired of those long hours, low pay, and constantly battling burnout, don't forget our free video training designed just for you on how to build and grow a sustainable, profitable solo or group practice. Head over to zynnyme.com/podcast to check it out today. Until next time.